helpful. We're joined by Congressman Chaka Fattah. Chaka.
Thank you, Mr. Chairman, and the chairman and I have worked together on a number of health-related issues, including blood safety and cord blood. It's done a lot of good, and I appreciate the invitation to join you. This is a subject that I have an extraordinary amount of interest in, and I was on the floor, slightly delayed. We just passed the appropriations bill, or we're getting ready to pass it, and included in that is language that I have authored to internationalize the collaboration that we built in at the Office of Science and Technology. Phil Rubin's work, we've created language that would build on the G8 summit and build on the work of the EU and Israel and so many other countries and groupings of countries who have started to focus in on this. And you know, George, you've been way out in front of this for a very long time, but I think I wanted to focus in on what you think the Congress can do. You know, we have the national plan. We put additional dollars. There is, as you just mentioned, Mr. John, a sense of a tipping point. There's some very important clinical trials that are taking place now and getting ready to be launched into second and third phases. I mean, there's some things going on, but we are not in any way yet where we need to be. And so I note in your testimony, George, that you suggest that the Congress should, in a similar fashion as we did with HIV, build a much more global approach to this effort. So, and if there are any other specific recommendations that the chairman and I and others who are interested in these matters may be able to focus in on.
Well, you said I was way ahead, but I am following you, Mr. Fattah. You have been in front of this issue on neuroscience and how to get a White House office focused on it across agencies and now internationally, and I commend you on your leadership on these issues. I think that we need to press forward and periodically have this committee and other committees of Congress make sure that we are moving forward during 2014. It is a critical time, as Harry has mentioned, and I agree, that we assure ourselves that we pick this moment in time and say this is a turning point, not just a dot on a long line, so that we in fact hold accountable for all of the commitments that are made out there and insist that the U.S. government demonstrate how it is that they are moving this forward and using their leadership to do so. I've suggested to the chair of this subcommittee that there be a set of parliamentarians that you meet with EU parliamentarians, UK parliamentarians, Canadian parliamentarians, and Japanese parliamentarians to assure that there is political backbone to the commitments that are made, because it's going to take the parliaments of these countries as well as the national leaders and the health ministers to assure that we get to a unified effort. I think that you need to invite the private sector to the table in a genuinely open and joint kind of approach, a unified approach. HIV/AIDS, in the end, I'm not going to say the end, we haven't finished the end, but with respect to what started to drive that was the unity of purpose, the unity of effort, and thus the clarity of a combined plan which everyone's roles were well defined and where people executed against a plan and could rely on each other to execute against a plan. So bringing together all of the stakeholders, now you can't bring Madison Square Garden, but the leaders of the stakeholders, and make sure the processes are transparent, to force this development of a global action plan, to authorize the existence of a global fund, will signal that in fact this nation is prepared to continue its historic leadership on these global health efforts and actually move the needle to assure that what happened in London doesn't stay in London.
Let me ask just two very specific, concise questions, Mr. Chairman, on this point. So one is the EU has a joint clinical trial initiative in which they've gotten all of the EU countries engaged along with Israel, and we have not joined in yet. And as a nation, I think we should, because this issue of the clinical trials, which you mentioned in your testimony as I was coming in, I think is very, very important. We have opportunities inside of the work that you have talked about in terms of the pharmaceutical community. I've suggested that, you know, not only do we have Alzheimer's, we got 500 plus other diseases and disorders that we haven't come up with effective treatments for. I'm trying to understate this. And I think we should be much more welcoming in terms of trying to get the pharmaceutical industry more full-throatedly involved in this, and even to the degree that we might have to adjust exclusivity issues, patent issues, in ways that could provide more of a runway for them in terms of the fiduciary burdens that they have, or find ways for them to partner, like with the Alzheimer's Association you're doing, for them to do research separate and aside and outside of their fiduciary burdens, so that we can move forward. So if you could react to just to those two things,
yeah.
I'll be
The Innovative Medicines Institute of Europe has issued a call for proposals, to which the response time is roughly April, to come up with consortia that will develop a Europe-wide clinical trial network system. They've invited the Global CEO Initiative, the industry coalition that I convene, to come up with a North American side to that. And whether that's a side or whether we develop a global platform and we work with them, there is a enormous momentum on both sides of the Atlantic and in Japan, but right now it's focused on both sides of the Atlantic to do something with clinical trial efforts in Alzheimer's, to develop linked patient registries so that we know the characterization that's been made of patients around the world, that they get into longitudinal trials that are well characterized and studied, and that in fact we populate or pre-populate potentially global clinical trial platforms. So that project effort is underway. There's no question it's going to be requiring some government assistance, but hopefully it will also involve some private funding, since the value creation is good for industry as well as for governments. Your second point, because yeah, sure.
Well, you know, certainly this issue of improving participation in clinical studies is absolutely essential. We know that already the 3 big prevention studies that are underway, just getting underway in the United States, are going to cause the need for many, many more people than we previously had participate. It's important to note here, if you don't realize already, that one of the things that's happened as a consensus in the science community on this particular condition is that there's a belief that intervening earlier in the disease is absolutely essential. So that's going to mean actually a prevention approach to the disease. The prevention approach means that many of the people who would need to be accrued into clinical studies will not have symptoms, will not have the disease actively in terms of ability to see it other than potentially on a biomarker scan.
What we think of as early onset is pretty far along.
That's
so
exactly
we need
right.
To stop. We need to step in. But my second question was on this question about patent lengthening the period of exclusiveness for treatments and solutions as a way of maybe taking a carrot approach to a more robust effort among the pharmaceutical industry, because right now we're nowhere. We need to get somewhere, and I'm convinced that the academic side of this is very important, but I also think that the pharmaceutical industry is going to be as essential as they were in the example you point out with HIV.
You know, both you're absolutely right, Congressman. Both are absolutely essential. Part of the problem, though, has been the underfunding on the front end of the pipeline. This is critical to recognize, because the pharmaceutical companies, if we had sitting here next to us one of the leaders of one of those companies, I've sat on panels with them previously, they would also tell you that they need the fueling of the pipeline. In all diseases, the basic research is not done by the companies, because Wall Street will beat up their stock price. They won't be able to make the investments in the parts of the pipeline, the later stages of development that they need to make. So it's absolutely critical that we tie these things together, not only the kinds of considerations you're raising this particular question on, but also that investment in the front end of the pipeline to make all of this work together.
You'll see in the G8 commitments, there is an explicit commitment. Take stock of our current national incentive structure for research, working in partnership with the OECD. So there's an invitation to you, Congressman Fattah, to respond to the G8 by taking stock of our current national incentive structure. I encourage you to do so.
Oh, it's a privilege. And it, as Chaka said, we have worked together on so many other issues, including Safe Love initiatives in Africa. So thank you for your work on Alzheimer's. It's